Good morning, good afternoon, good evening, everyone joining us here today for this press briefing. We are on the occasion of the launch of the Pan-European Commission for Health and Sustainable Development, hosted by the WHO Regional Office for Europe. Very grateful you could all join us today from the press corps. We've received some questions in advance. I'm looking forward to getting to those shortly, but of course, as a reminder, please raise your hands in the system so I can see you have a question, and I will then put it to one of our panel members. On our panel today, we're joined, of course, by our Regional Director, Dr. Hans Kluger, and also here in Copenhagen, our Regional Emergencies Director, Dr. Dorrit Nitzan. It is a great honor also to be joined by Professor Mario Monti, who is the chair of the Pan-European Commission on Health and Sustainable Development, current president of the Bocconi University and former Prime Minister of Italy. He's also a former European Commissioner. So Professor Monti, thank you very much for joining us today. We're also joined by Professor Martin Mckee, who is a member of the Commission. He's also the lead rapporteur and Professor of European Public Health at the London School of Hygiene and Tropical Medicine and the Research Director at the European Observatory on Health Systems and Policies. I'd like to thank our panel in advance for joining us today. We'll shortly come on to some questions for you in a moment, but first I'll hand the floor over to our Regional Director, Dr. Hans Kluger.
Thank you very much, Rob, and thank you everyone for joining. As the Regional Director of the WHO Regional Office for Europe, I convened the Pan-European Commission on Health and Sustainable Development to rethink policy priorities in the light of pandemics. This came along when we saw how society was impacted as never before since the COVID, and the need to rethink policy priorities and position health at the top of the political agenda, acknowledging that health is the powerful determinant of economic development and social cohesion. What does it mean for the people to live their lives in the future and to have equal opportunities to live a quality life? That's why I reached out to Professor Mario Monti, and I'm really very honored that Professor Monti had accepted to be the chair of this prestigious commission. The reasons why I reached out to Professor Monti for us were straightforward. Professor Monti has the international leadership skills and reputation to chair such a multi-sectoral commission. And that's very important, the word multi-sectoral, because this is not a health commission. We know that the COVID has impacted all sectors of society, and health can be the solution. As Rob was telling, Professor Monti is also a former Prime Minister and European Commissioner, and very crucial also, speaks the language of both politicians, and we know how important this is, the political economy, to position health high on the agenda, but also to have academic rigor and be in touch also with the people. With this, I'm giving back to Rob.
Thank you very much, Regional Director. So it is with great pleasure that I now ask Professor Mario Monti to take the floor and make a statement. Thank you, sir.
Thank you very much. It is a pleasure to be with you. I'm here at Bocconi University in Milan. I welcome the members of the press, as well as some of my colleagues on this really challenging adventure, like Professor Mckee. I'm very honored to have him on the Commission. He's really an extremely high-level authority in public health, well recognized internationally. It is above all you, Dr. Kluger, you, Hans, whom I wish to thank for your very warm words of introduction, but also for your vision and for driving this initiative from your conceptual sphere, because you are the father of the idea, to bringing this commission to life, and for inviting me to be its chair. It is indeed a pleasure to say a few words on the Pan-European Commission on Health and Sustainable Development. In a sense, the pan, the whole, is the dominating word here, because we have a pandemic, we have a Pan-European Commission, 53 member states, as you know well, belong to WHO Europe, or WHO Europe belongs to 53 member states. But I would say that the pan extends also to the core substance of our work, which is really very well defined, I believe, by the subtitle, Rethinking Policy Priorities in the Light of the Pandemic. So it's an exercise in a holistic approach to see how the pandemic has to bring lessons, not just on how to improve, make more resilient, and so on, the health and social care systems, which is a huge enough task, but also what changes it should bring in the way in which policy decisions are made at the highest level of governments. Yesterday, together with our 17 commissioners, with the scientific coordinator and with my special advisor, Alexandra Torbica, who is here next to me at Bocconi, we held our first meeting. At this meeting, we agreed on the scope of our work, what we will deliver, and how we will coordinate. So why the Commission? This was clearly expressed already in a very concise manner by Dr. Kluger. This pandemic has been and is being, unfortunately, still a defining crisis of our times. It has caused the tragic loss of so many lives, and because of the complex interplay of health, social, environmental, economic, and political factors, how we learn from and respond to this crisis will also determine the well-being of current and future generations. Our health systems, economies, social care structures have proven fragile when faced with this virus. So it has been an unsolicited, monumental stress test for all of our systems and for our countries even. To fight COVID-19 effectively requires collaboration, coordination, and solidarity across communities, sectors, and countries. The pandemic has illuminated, of a rather dark light, I should say, the stark inequalities of our modern world, but it has also underlined more than ever the truism that no one is safe until everyone is safe. COVID-19 is an unprecedented health crisis that does demand an unprecedented response. But it also offers a unique opportunity to rethink and reform our health and social care systems to ensure that they are resourced, robust, and resilient. Of course, as we come to the more specifically to the goals of the Commission, the goal of our Commission is definitely not to tackle the immediate huge current problems of the ongoing pandemic. This, of course, is what all countries, all member states of the Europe region and of the world do. This is what WHO and specifically of the European region does. And I am delighted that in cases of questions from the press today on what really matters most at this moment, so the ongoing threats and the ongoing attempts to solve these threats, these threats. We have here very competent people, not only Dr. Kluger and Professor Mckee, but also, and I welcome her very much, Mrs. Dorit Snitsan, who has the whole situation in mind and under, I hope, her control. The Pan-European Commission on Health and Sustainable Development has been established to do the broader, the longer term, the more comprehensive and the more holistic job. And it is the first of its kind that I know of, at least. The Commission will take a magnifying glass to current economic and social policies, using the evidence of how these policies have performed in light of this pandemic, to make recommendations on how such policies should be enhanced at the national and international levels to forecast, prevent, and respond to future crises. The Commission will also reach out and establish partnerships with countries and international agencies to facilitate the policy discourse with and between health authorities, experts, and citizens' assemblies and groups to build the resilience across health systems and societies. The Scientific Advisory Committee, coordinated by Professor Elias Mosialos, and with the, I repeat, also the highly authoritative presence and contribution of Professor Mckee, will ensure that the Commission's work is grounded in experience and based on empirical evidence. The Commission has been convened on the initiative of Dr. Kluger, and it also has the support of Dr. Tedros, the Director General of WHO. But they have emphasized, and I would like to reiterate an important quality and responsibility of our Commission. That is, the Commission is fully independent. It's not a Commission to which either WHO or national governments give guidance. That might have facilitated our task, but we would not have accepted that, because we are assembled to break our own minds and to find out collectively what we believe could be a series of wise proposals. So it is fully independent. The work of its members, the agenda, the recommendations, when they will come, are driven by the Commission itself. But of course, this, first of all, would not have existed without the daring initiative of Dr. Kluger, and secondly, could not exist and proceed in its work without the fundamental organizational, logistic support that an institution like the WHO can provide us. one final reflection on this work, which is of great importance to me personally, is that although the Commission's recommendations can and should break new ground in terms of who they bring together and should catapult health and well-being to the top of the political agenda, they must also be inclusive, practical, and applicable. So this is not a commission of professors simply, although there are many and highly qualified. This is a commission of thinkers in different fields which feel the responsibility of producing something that can be agreed upon or not, but that has at least the vocation to being practical and applicable. Who are the members of the Commission? To undertake such a monumental task requires bringing together the highest caliber, I would say, of experts, of expertises and experiences from a range of fields. It is my great privilege to chair such a distinguished group of leaders, policymakers, scientists, and civil society chiefs. The Commission comprises former heads of states and governments, distinguished life scientists and economists, heads of health and social care institutions, and leader of the business community and of financial institutions. Members have been appointed to the Commission, obviously on a non-remunerated base, by the WHO. They've been selected and proposed with consultation with me by Dr. Kluger. They have not been put forth by governments, although we count very much on the constructive cooperation between members of the committee, of the Commission, and governments. I am both delighted and humbled to take up this challenge. Together we have the opportunity to shift political thinking, to prioritize health, to build consensus on how to achieve this, and in so doing, perhaps set this continent on the right path to build happy, healthy, prosperous societies. So my fellow commissioners and I have much work to do. We have committed to deliver these policy recommendations in 1 year from now, to launch our report in September next year. I hope you, members of the press, of the different media, will follow us on this journey, stimulate us, criticize us, if possible, when you begin to have something to be potentially criticized, and join us in the autumn of next year to take up our findings and recommendations. So, thank you very much, and I return the floor to Rob, our moderator.
Professor Monti, we are incredibly grateful for that opening statement. Thank you very much, sir, indeed. I'd next like to turn the floor very briefly to Martin Mckee to say a few words about the Scientific Advisory Committee to which Professor Monti referred. Professor Mckee, the floor is yours.
Thank you very much. I'd maybe like to preface my comments with just a few reflections. And it may seem strange to say this, but in some ways, we've actually been quite fortunate in this pandemic because there are many other viruses that spread much more quickly, like measles. There are other viruses that are more lethal. This is not the first pandemic. It will not be the last one. So this is a warning for us. In a way, it's a dress rehearsal for what could come in the future. So we really do need to get this right. And we also recognize very clearly that we need to look at a number of eyes in all of this. We need to find solutions that include people, that are inclusive. We need to find new ways of doing things, ways that innovate. We will need to invest in the new ways of doing things. And we need to involve everyone to take the research concept of co-production, to listen to people and to bring in ideas from a wide range of disciplines and from a wide range of people. So we will have a scientific advisory committee. It will bring together people from a wide range of disciplines, because this is a complex, challenging problem. And it's not one that can be answered by epidemiologists or statisticians or political scientists on their own. We need all of these things brought together. Obviously, we will have a diverse panel in terms of gender in particular, but also we will have diversity in terms of contributions from across the entire European region. One of the very important things about working with WHO is, of course, WHO spans the 53 member states, going from the Atlantic to the Pacific. So we need to find solutions that are relevant to all of the countries involved. The role of the Scientific Advisory Committee will be to ensure the quality. It's a quality assurance mechanism. Individual members will contribute based on their expertise. We will invite them to review evidence, to write short pieces that will inform the work of the Commission. But above all, their responsibility will be to make sure that what goes into the report of the Commission is factually accurate and reflects the entire range of issues that we need to take into account. I'm happy to take questions.
Thank you very much indeed, Professor Mckee, and thank you again for joining us on this panel. So I'm going to get straight on to the questions from the media. Please do raise your hands in the system, in the Zoom system, should you wish to raise a question. But I have some questions here that have been submitted to us in advance, so I'm going to take a couple of these first, if I may. The first is from Anna Bejenaru, from national TV in Moldova. And the question is, how are the Commission's recommendations going to be applied after the final report is released in 2021? And I'd like to ask Professor Monti, if I could, I'll repeat that, sir. How are the Commission's recommendations going to be applied after the final report is released in 2021? Can I pass that over to Professor Monti, please?
Thank you. Thank you very much. As I already hinted, the Commission will work very much in consultation with several external actors, of course, WHO, governments, civil society, etc., etc. So there will be some on the road taking of the temperature and of building up a common feeling. We will not be out of touch with the real world when we publish our final report. Then the question is really, how is WHO Europe going to apply the Commission's recommendations? So maybe this part of the question should be addressed to WHO Europe rather than to the Commission. But what I would like to insist upon, and then maybe Dr. Kluger might wish to add something from the WHO's perspective, what I'd like to insist upon is that in this case more than ever, but also in previous policy-oriented commissions that I had the honor to chair in my life, often European Union commissions, my colleagues and I have always put a lot of effort in making the recommendations eventually produced understandable, if possible, easily understandable, not just for the, in this case, the WHO, the ministers for health, the experts, but also, I hope, for the public opinion more at large. It will be important also in producing recommendations to be aware and to show that we are aware of the political difficulties of adopting and then eventually of implementing this or that recommendations. We are not the decision makers. Some of us have been decision makers in the past, but we are not decision makers in this commission. But I think we have been selected also because people expect from us an awareness of the political difficulties, of the trade-offs, and of the need to communicate with the public opinion that characterizes political activity. So we will tend to produce understandable recommendations, actionable recommendations, and also we will then provide to the WHO Europe, to governments, to the potential policy makers who will be the ultimate addressees of our recommendations. We, if they so wish, we would like to present them also with instructions for the use of the recommendations, namely the map of the difficulties that we would expect them to meet in adopting a certain recommendation, etc., etc. I don't want to promise too much, but this is the user-oriented mentality that I will try to adopt with my colleagues in the Commission. Maybe Hans, would you like to say, if it is possible now, maybe you can tell already that you have no intention whatsoever to make any use of this Commission's recommendations. But I'm not sure this is the case one day after the initial meeting.
Thank you, Professor Monti. You were very, very comprehensive. So a short addition indeed. Focus on easily understandable, practical and applicable. While the Commission is indeed independent, any policy recommendations, of course, are to be considered and implemented by countries. That's why we have invited Professor Monti also 14 September at the first day, which is the political day of our annual governing body board. This is called the WHO European Regional Committee with the 53 member states for a introduction, a briefing. After each meeting of the Commission, there also will be a briefing for the 53 member states and the ambassadors in Copenhagen, Geneva and Brussels. So to ensure, as Professor Monti was telling, to keep the finger at the pulse, that as the work is ongoing, there is indeed a very wide dissemination of what's ongoing and also, if need be, some course corrections. Thank you.
Thank you very much, Professor Monti. Thank you, Regional Director. Right, so we'll go to questions online. I'm first going to go over to Marcia Nieuwenhuis. Forgive my pronunciation of your surname. Marcia is at Algemeen Dagblad in the Netherlands. Marcia, please go ahead with your question.
Thank you. Great job. New in house it is, but it's okay. I was wondering if you can already say something about the current policy. I read that you are investigating the regional measures which can be taken in the current pandemic. Can you already say something about how countries act with these regional lockdowns? Or am I too early? That can also be the case, of course.
We don't think so, but I'm going to ask Professor Mckee if he'd like to respond to that question from Marcia. Professor Mckee, did you get that?
I did, but I'm not sure I fully understand it. By regional, at what level of regions? Maybe you could clarify.
Marcia, can you go ahead and just give us an abbreviated version of the question, please?
Yes, of course. In the announcement of this press conference, it said, sorry, I'll quote it exactly, that you will also make policy recommendations regarding health and social care, but also draw regional lessons from the current pandemic.
Sorry, I understand that. So this means
and
that
those I mean, actually.
Yeah, the regional. So essentially what we're saying is that the scope of the Commission will be across the entire European region, which, as I said earlier, goes all the way from the Atlantic to the Pacific. And we will make sure that the recommendations are inclusive of all those very diverse countries, going from Central Asia through to, in fact, to Iceland, and cover everything.
Professor Monti, would you like to add anything to what Professor Mckee has responded?
Not really. I think that addresses the question. Thank you very much.
I'm actually going to go around the panel on this one because I think it's a good question. Dorrit, can I ask you to say a few words? Lessons learned to date. Thank you.
Yeah, thank you very much. I'm really honored to join such giants, but I would like to mention that our regional director is doing something really special in our region. We are assessing and reviewing our own and reflecting our own way of work, and with different tools. We call it the Intra-Action Toolbox. And this toolbox is comprised of 3 pillars. One of them is an interaction tool for the countries to assess themselves while we guide them. We have a team now on the ground in Uzbekistan, joining Germany, where we are trying to guide and to see how they can assess it. They will internally also come and reflect to us on how we acted. And then we also have, in this toolbox, we had focus group discussions with the countries and with our staff on the ground and here. And we also prepared a timeline, kind of tracing all the events to see where we could have acted faster, better, and etc. So this toolbox will be presented to the Commission for their work. Thank you very much.
Thank you very much. Right, so I'm going to next go over to Jamie Keaton, who's joining us from Associated Press. Jamie, welcome back.
Can you hear me?
Yes, we can. Please go ahead.
Great, thank you so much. My question is for Dr. Kluger. I actually have 2, but I'll stick into one. Dr. Kluger, there's been an uptake in cases in some parts of Europe, as you know. Do you expect to see that translate into an uptick in deaths in a couple of weeks? In other words, is it younger people who are getting infected now? And if so, do you fear that they will then infect the more vulnerable groups and we'll see more deaths?
Please.
Thank you, Jamie. So indeed, throughout the summer, and that's what I have been telling through the press briefings, we have been seeing a increased incidence in the younger age groups, and the message has been consistently, no one is invincible, right? That it may be that the younger people indeed are not necessarily going to die from it, but it's a tornado with a long tail, and it's a multi-organ disease. So the virus is really attacking lungs, but also heart and other organs. And at one stage, younger people, particularly with the winter coming, will be in more close contact with the elder population. So we don't want to do unnecessary predictions, but this is definitely one of the options, that at one point there will be more hospitalizations and an uptake in mortality. The key message is, Jamie, we know what has to be done. So let's implement what needs to be done. The governments to show leadership on risk communication, increasing testing and contact tracing, and that works, we know, based on a strong primary healthcare and public health system, and for the people to follow the basic public health measures, because ultimately it's us who are determining the course of the pandemic.
Okay, thanks very much, Jamie, and thanks, Regional Director. I'm going to follow on with a question from Politico, Regional Director, from Carlo Martuscelli, from Politico, who asks, given the increases that we're already seeing in Spain and France, how dangerous is the autumn? I feel that that kind of leads off from your last point, but maybe you could elaborate on that. So that's given the increases that we're already seeing in Spain and France, how dangerous is the autumn? And there's a second question here from Carlo. What is the worst case scenario? So maybe I'll go to you first, and then I'll go to Professor Mckee for the second part of that question.
Thank you, Carlo. So, key here is that we are not back to February. It is true that we see in 32 out of 55 state parties and territories a 14-day incidence rate increase of more than 10%. So definitely there is an uptake which is generalized in Europe. But in February, we were caught by the speed and the devastation, and the default option was to lock down and reboot. Now we are much more sophisticated in our knowledge what works. In that sense, that it's possible to manage the transmission of the virus in society and have a running economy, and very important, have a educational system open. Because it's true, it's a tricky moment now when we transition from the summer to the autumn with three phenomena coming together. One is the reopening of the schools and the academic year, and I really want to express appreciation to the Minister of Health of Italy, Roberto Speranza, who together with me, the 31st of August, will co-chair a regional conference on safe and gradual reopening of the schools. That's the first phenomenon. The second phenomenon is the influenza season, and the at-risk groups really are encouraged to get a flu jab as early as possible. And the third phenomenon is the excess mortality we see in elder people during the winter. So vigilance is really the key word.
Super. And maybe I could go over to Professor Mckee. So to elaborate on that, and also to answer the second half of this question, what's the worst case scenario? Professor Mckee.
Okay, well, the worst case scenario is simply a function of the mathematics of the transmission of this virus. And people have talked a lot about the reproduction number, and left to its own devices, as we've seen, you can go from one case to tens of thousands within a week or so. And unfortunately, that was what happened in the beginning. Fortunately, as the regional director has said, we have learned an enormous amount in the intervening period. And we've learned about the transmission of the virus. We understand more, in particular, about the role of aerosols, of the own droplets and touching things. So we know much more about that. We know more about prevention. We have seen the increased emphasis on face coverings, particularly in situations where people cannot distance, particularly in enclosed indoor spaces. And we've also built our capacity substantially in terms of our ability to find, test, trace, isolate, and support cases on a much more granular basis, so that instead of locking down an entire country, you may be able to move in and impose restrictions on an individual factory or a few streets. or whatever, which is a huge advantage. And of course, the other thing that has happened is that we now know much more about the treatment of this condition. We've moved on from thinking that it was primarily a viral pneumonia, which was the model we started off with the focus on ventilators, to recognize that it is a complex multi-system disease affecting in particular the cardiovascular system, but many other bodily systems. And we're beginning to get some treatments that can help to reduce the mortality, but also a lot more experience with the management, which improves the clinical outcomes. That said, there's still much more that we could do. And because we still don't have everything we need to know about treatment, it is unfortunate that in many European countries, people are still being treated without putting them into clinical trials. We really should be having a situation where all patients, as far as possible, should be entered into clinical trials subject to their consent so that we really can get effective solutions. And that is not happening. The downside that we need to pay attention to is that we need to move beyond a recording of the number of people who get the infection, the cases, and the number of deaths, as we are recognizing that there are a growing number of people who are sort of in the middle with what we're calling long COVID, which are complications of this disease that do seem to be affecting quite a few people, and particularly young people, leaving them with potentially significant damage to their respiratory and cardiovascular systems. So we're in a different position from March. We know an awful lot more. Much of that is good and will help us to respond, but this is still a very dangerous virus, and if we are to let up our guard too much, then it will come back with a vengeance. We've achieved what we've achieved by quite extensive restrictions, and as we've seen, when we lift them up and we relieve them a little bit, then the virus uses every opportunity to come back.
Thank you very much, Professor Mckee, and thank you to the Regional Director for those responses. So next I'm going to go to Vince Chadwick at DevEx. Vince, please go ahead with your question.
Thank you. Hi, everyone. I've got a question. I'm based in Brussels, where the Belgian government has been criticised for turning away elderly people from hospital in the interests of keeping beds free. I'm wondering if the Commission will evaluate that policy choice as part of its work, and whether there's already some impressions that you're able to give today on that point. And my second question is, how much will the Commission cost? Does it have a budget? Thanks.
Okay, so I'm going to ask Professor Mario Monti to respond initially, and then I'll go over to the Regional Director, if I may.
Yes, sorry, I did not, there was an audio problem here. I did not get the question very well.
That's fine. We can ask Vince. Can you go ahead and just ask those two questions again, please?
Sure. Sorry. The first question is, will the Commission consider the issue of whether to admit elderly people to hospital or whether, as Belgium appears to have done, to leave beds empty in the interests of capacity and to leave people in nursing homes? I think the New York Times did a strong report recently about the consequences that had in Belgian nursing homes. And what is the budget of the Commission, please? Thanks.
I think we're having some problems hearing you over in Bocconi, so I'm going to ask maybe if the Regional Director, could you just add a few points, maybe starting with the cost of the Commission.
Right. So there is a minimal budget indeed foreseen from our core funding for this endeavor, particularly for the logistics and the administrative support. But I would like to stress that the Commissioners have all agreed to provide pro bono contribution, so their work will not be remunerated, and I think that's also linked with the reassurance of the independency of any interest and the independency of the Commission, and also we can count on the support of a number of member states, but independent. So then maybe to on the other point, so the Commission, but then I will hand over to Professor Mario Monti, is not going to do a country-by-country evaluation of the COVID response. In fact, the WHO Director General, Dr. Tedros, who, as Professor Monti was mentioning, is fully supportive of the Commission, he is tasked by the World Health Assembly to establish, which he did, an independent panel to look at what worked and what didn't work under the COVID-19. So this independent panel is for the world, is looking backwards, particularly focused on the COVID-19. The Commission is looking forward. Obviously, we'll take into account what happened during the COVID, because that is what catalyzed the establishment of the Commission, but it's a forward-looking Commission, not only dealing with the COVID, but really looking at the Sustainable Development Goals. Because COVID is one pandemic, but let's not forget we have many other pandemics. The cardiovascular diseases, the mental health issues, the suicide. So in that sense, the Commission is looking much broader. But I was telling this in anticipation of Professor Monti.
Professor Monti, please.
Yes, I apologize to the gentleman who asked the question that I had a difficulty in the immediate comprehension of it. Now, of course, I understand and share completely the position expressed by the regional director. If I may, I would further clarify things by saying that it will not be our task to concentrate mainly on the individual trees, that is, the experiences on the ground of the individual countries. We will deal more with the forest in a sense. So we will, of course, take advantage of the reading that it's possible to do, and the WHO and the Scientific Advisory Committee will help us a lot in having this reading of the experience. But in our case, it will not be a granular reading meant to issue specific admonitions or recommendations to individual specific countries, but will be more the overall picture, and above all, the relationships between the individual tree, the forest, and the overall environment in which the forest finds itself.
Thank you, Professor Monti. So I'm next going to go to Jérémy Lange from Radio France, RFI. Jeremy, please go ahead.
Yes, thanks again. Just wanted to have a question about what the French Prime Minister just said. He just invited the grandparents not to get their grandchildren from school for the time being. I was wondering if you would have the same advice. Do you advise some kind of lockdown between grandchildren and grandparents when school is resuming? Thanks.
Thank you very much, Jeremy. I'm going to send this over to Dorrit, and then I'm going to ask Professor Mckee to possibly add a few points, should he wish. Dorrit, please.
Did you get my question? I feel like you didn't.
Dr. Nitsan, can you hear us? Dr. Nitsan, did you hear the question, Dr. Nitsan?
Yes, I think part of it. I got the idea, I think. Yeah. So should I go ahead?
Yes, please.
I give it a try.
Yes, please. Thank you.
I think the question was about grandparents and children. So the message that we are asking communities is to assess the risks. And we know that the elderly are at high risk. They are the most vulnerable and need to be protected. And protection can be done in different ways, and we leave it to the communities to decide in which way is most appropriate for them. What we welcome on the 31st, we will discuss it. As our regional director just announced, we will discuss also these issues, as well as other aspects of schooling during the time of the COVID-19, and look at the benchmark, our real resolution of recommendations that we would give. We will consider that in our discussions with the countries on the 31st. Thank you.
Professor Mckee, would you like to add anything on this point?
Nothing particularly, not to start.
Thank you. Okay, so we're going to go to Carlo Martuscelli again from Politico. We have a follow-up question, and this I'll put to Professor Monti and then ask Hans, our regional director, Hans Kluger, to comment on thereafter. But Professor Monti, some of Europe's more fragile economies, like the south of Italy, Greece, and much of Eastern Europe, were not hit as hard as the rest of the continent by the coronavirus in March and April. Do they have the economic resilience and health infrastructure in place to withstand a large-scale second wave? So, Professor Monti, I might cast this over your way, particularly with regard to the component regarding the do they have the economic resilience to withstand a large-scale second wave? Over to you, sir.
Yes, thank you. This is a very interesting question, which deals with the ongoing pandemics, but with some distinctions over time and over geographies. I would say that, first of all, these are indeed less strong, economically speaking, regions than other parts of our continent, no question about that. And I must say that, as far as I know, I was in March and April just an ordinary Italian citizen, as I am now, but obviously I could not ever imagine that one day I will be called upon to reflect on the pandemic. I simply tried to protect myself and my family from the pandemic at that time. But I think that there was also some good and timely policy decisions taken by authorities that spared initially those parts of Europe. And I believe that our colleague on the Commission, Professor Mosialos, had a role as far as Greece is concerned in keeping the initial impact very, very modest in Greece. Then, of course, there was the tourism season, which complicated things. Now, I think that a large-scale second wave may well be a problem, but it comes when at least some lessons have been learned by everybody and by the national and regional authorities of these countries concerning the first wave, so that the experience here will allow some quick learning, at least in how to cope with the pandemic. Then I would like to say that to the extent that these are countries which are members of the European Union, which is certainly the case for southern Italy, Greece, and some parts of Eastern Europe, well, the European Union has acted certainly quickly by its own standards, and more quickly than on previous occasions, in putting in place a massive policy response, including strong financial support in the form of the Recovery Fund of unprecedented amount for member states, and even more specifically the pandemic credit line that the EMS, the ESM, the European Stability Mechanism, is ready to grant to countries requiring it. So all this indicates that these regions, although they are less advanced in terms of economy and health infrastructures, are at least better positioned now, thanks to experience and also thanks to a heavy EU commitment, than they would have been on day one had they been hit by a stronger wave of pandemic. I don't know whether my answer is understandable, Mr. Martuscelli. Should I clarify better?
Thank you.
No, that's great. Thank you, Professor.
Thank you so much, Professor Monti. Indeed. And from the health side, I would like to remind about the pandemic also, remind us of the basics, which is primary health care. Every country in the world is able to strengthen its primary health care and community care and essential public health functions, because no any pandemic has been won in the hospitals. So it comes back to the core primary health care, close to where the people live and work.
Okay, thank you both very much. And one final question, so I'm going to go over to Nick Cumming-Bruce at the New York Times. Nick, can you hear us?
Yeah.
Please go ahead.
Very much. Thank you. Just following on really from some of the questions already asked. But, European countries are getting to terms with what's needed to reopen their economies. There seems to be, however, very little commonality in approaches to reopening schools. And I'm wondering how far you assess the risk of that school reopening will become the major driver of new infections going into the autumn.
I'll pass that over to the Regional Director.
Thank you so much, Nick. That's exactly the reason that we are convening the 53 member states on this matter, and also 7 September on the high-level committee with the government in Portugal, we will be presenting. What we know is that we can't open societies without opening the schools first. This has been the biggest disruption in education in the history, with 1.6 billion learners affected in more than 190 countries. So the key issue here, Nick, is that it depends a lot on the level of transmission in the community. Basic measures have to be applied everywhere, but then depending on where you are in the pandemic in the community, additional measures have to be implemented. So far, we know that in the school settings has been not a main contributor to the epidemic. There is also more and more publication that adds to the body of evidence that children do play a role in the transmission, but that this is so far more linked with social gatherings. So this is one of the unknowns, but definitely top priorities for the policymakers and the World Health Organization.
So thanks very much, Regional Director. I'd like to thank the other panel members. We've come to the top of the hour, so I'm going to close this press briefing. Thanks to Dr. Dorrit Nitsan for joining the Regional Director here in Copenhagen. Also thanks to Professor Monti and Professor Mckee. Very grateful to have you on our panel today. I'd like to thank, of course, the media for joining us today, and looking forward to seeing you again at the next press briefing. So in the meantime, please stay healthy. Take care.